Okay, so the arachidonic acid cascade. So how this works is through a number of different ways, like I said. So it's really important to drug design because it has so many pathological outcomes from this cascade. And so what happens is that we have a cell membrane. So I'm drawing a cell membrane now. Draw the same. You can see what I drew in a second here. So we have our cell membrane, right? And so there's our lipids. And with inflammation, so let's say that your body, you cut yourself or something, or you have, say, allergies, or a trigger to an asthma attack, etc. It's inflammatory response. What's going to happen? So some kind of inflammation is going to make this happen. What happens is that an enzyme called phospholipase A2 cleaves off pieces of the membrane. So phospholipase A2 cleaves off lipids from the membrane in response to that inflammatory signal. And so you're going to get this lipid. That's been cleaved off. And through some lipoxygenases, these lipids are going to turn into leukotrienes. And so these are normally supposed to be bronchodilators, but they can also lead to asthma, the production of leukotrienes. So this, every time I write something over the arrow, that's an enzyme. So this enzyme lipoxygenase is going to lead to these lipids being turned into leukotrienes. Leukotrienes are going to result in lung and inflammation of lung of the bronchi, the tubes that lead to the lungs, and that's going that leads to asthma response. But these lipids can be worked on by other enzymes as well, and so in response to cyclooxygenase. So that enzyme's also abbreviated COX. So cyclooxygenase, in response to cyclooxygenase, we're going to get prostaglandin H2. And prostaglandin H2 and platelets. So those are components of your blood. They're not they're small cell-like components of your blood, cell fragment really. So in platelets, you're gonna get platelets are gonna turn prostaglandin H2 into thromboxane H2. Well, actually, the thyroid turns prostaglandin H2 into thromboxane H2. So I should write thyroid here. And then we'll write clotting in platelets. When the thromboxane H2 hits the platelets, it results in blood clots. And so blood clots are bad news because they can lead to heart attacks and strokes, etc. Prostaglandin H2 is the parent, so this is the precursor. So prostaglandin H2 is the precursor prostaglandin, but it can be modified into other prostaglandins. So I'm just writing other prostaglandins here. And these other prostaglandins can lead to fever. They lead to pain. They lead to other inflammatory processes. And they also protect the stomach. So they lead to fever, they lead to pain, they lead to inflammatory processes. They also protect the stomach lining from damage too. Damn it. So clear, we just had to get rid of those, right? In blood vessels, prostaglandins can also be turned into prostacyclins. And these prostacyclins, these protect the heart. This is what the low dose of aspirin is supposed to do, is to increase these prostacyclins. And so these prostacyclins decrease clotting. So it goes between thromboxane H2 is increase the clotting, and prostacyclins decrease the clotting. They're both coming from prostaglandin H2, which is complicated now, because that means the precursor molecule to both increasing and decreasing blood clotting is the same thing. So it's complex. It's complex to design a drug to inhibit that. We need to figure out, is there any other enzymes in these arrows? Is there other enzymes in these arrows that we can control so we can either decrease or increase clotting as we want? And so non-steroidal anti-inflammatories, so that's like your aspirin or your ibuprofen, those kind of things, they hit COX. So they're hitting up here. This is where aspirin and ibuprofen are hitting. So that's how you're taking them for pain because you're trying to get rid of these guys, but they're also messing with all this other stuff as well because they're stopping production of this guy. So this kind of arrow where it's a right angle, this means inhibit. So this means, we'll talk about this on Tuesday. This is inhibiting the enzyme, making the enzyme stop being a catalyst that catalyzes prostaglandin H2 formation. So that's what NSAIDs do. And that means that they mess with all this stuff. So the idea is, overall, you've got this game between clotting, not clotting, and you need to get in there and play with it because a lot of people have problems with blood clots, right? Anybody that's got cell wall thickening, blood vessel thickening, artery hardening. Anyone who's got plaques in their blood vessels because they have too much cholesterol in their bloodstream. People that are on blood. So these things, when you hear about blood thinners, they're talking about inhibiting these kind of cascades. Really what they're talking about, some blood thinners work in different ways, and so the old school ones are working a little differently than this, but a lot of the new school ones are working on these cascades. So you can see now, right, you want to get in here and mess over with the leukotrienes to make asthma drugs. And you would really like to just deal with some of these crappy symptoms and leave clotting and not clotting alone for a lot of your inside work. And of course, you also want to protect the stomach, right? And this is one of the reasons that you get stomach damage from taking your NSAIDs. This is why they say if you have an ulcer or whatever, stomach bleeding, you're not supposed to take an NSAID and you need to watch for it, is that you are decreasing the amount of these stomach protecting molecules, these prostaglandin molecules that help your stomach not get destroyed by stomach acid.